Welcome to the EBTC webinar. This time we're going to be talking about introducing COSTER, which is recommendations for the conduct of systematic reviews in toxicology and environmental health. So first of all, some housekeeping. If you have questions to the panelists or the speaker, please use the Q&A function. You can use the chat function freely if you want to interact with each other or with the speakers. The webinar is recorded and it's going to be available after the session. And if you have any technical issues, please email our all-capable Camila at the email address provided on the screen. So let me introduce our speaker, Paul Whaley. He's a part-time staff at EBTC and is completing his graduate studies at the University of Lancaster. He is an advocate of the use of systematic methods in environmental health policy. His focus is on developing best practice frameworks, reporting standards, and critical appraisal tools for raising the quality of published systematic reviews. So the seminar is going to be co-moderated by myself and Sebastian, who is going to be monitoring the questions and chats. So what is EBTC? If you're not familiar with EBTC, we are an organization that's been started at Johns Hopkins Bloomberg School of Public Health. And we are an international collaboration of science, regulatory, and industry leaders with the common goal of bringing systematic reviews and other evidence-based methods into toxicology and environmental health. The statement about the funding is below. We are managed by the board of, governed by the board of trustees, which we're very lucky to have at our disposal as a sounding board, and the Scientific Advisory Council, which is advising us on scientific issues. And all of our work is done by the small staff who are listed on the screen. So myself, I'm a director of EBTC. There's Sebastian, who has been there from the very beginning, along with Marty Stevens, and Paul and Rob DeVries from Circle from University of Nijmegen, from Radboud University in Nijmegen. So EBTC work is conducted in the working groups, which are managed by EBTC staff and some of our Scientific Advisory Council members. In a collaborative fashion. And our work is divided in two sets, in two streams. So one is actually conducting systematic reviews and the other one is working on methodological issues, which is one of those issues is of great interest to Paul, and what he's going to be talking about now is one of the projects that he's working on. So why the systematic reviews? So we know from the clinical literature that the systematic reviews are considered to be the highest, giving the highest confidence in answering a scientific question and the lowest risk of bias. We cannot eliminate all bias from systematic reviews, but this is a methodology that's providing the summary of the scientific evidence that can help the regulators make the decisions about public health. So the toxicology is a particularly complicated field compared to the clinical research, which is usually including one species, which are humans. In toxicology, we're dealing with animals, and now more and more computational methods, in vitro methods and whatnot. And this is all needs to be integrated if you are trying to answer a question about the environment or an effect of a particular pollutant on health of the people or the population. So we are really dealing with a lot of heterogeneous evidence. So we need the tools tailored to these types of evidence, and the tools for integration of these evidence streams in risk assessment. So these are some of the conferences and workshops that and papers that EBTC has been involved in or coordinated and conducted. And I'm not going to go through that. You can access these slides later on. So we've recently conducted a couple of specific workshops aiming at looking at mechanistic evidence and how to integrate it into environmental risk assessment over the last year in particular. So this one was in Hamilton, Ontario, and the other one is in Parma workshop. So watch out for the publications on these workshops that are going to start coming out pretty soon. And finally, we just recently we had the pre-meeting again in June, where we had conducted this webinar, of course, like everything is done this year. So with that, I'm going to give the floor to Paul, and I'll stop sharing the screen.
Lovely, thank you, Katya. Yes, so this is actually the first of our EBTC online scientific seminars, and I'm a willing guinea pig in trying out how this works. If you want alerts about future seminars and other updates on our work at EBTC, then you should sign up for our newsletter, which is in this link. We will be circulating the slides after this webinar, so you can access any links there if you missed them here. And it's just very much a pleasure to be able to present this recent work that we've been undertaking to you all. So thank you for participating. So this presentation is about the recommendations for the conduct of systematic reviews in toxicology and environmental health research, which we're calling COSTER. It's been a project that's kind of undertaken just over 4 years ago, and then we recently published the final manuscripts. There's been a lot of work for a lot of people, and we hope you find this interesting. So I'm a researcher and consultant. I'm based at Lancaster University in the UK, and I'm also a research fellow at the Evidence-Based Toxicology Collaboration. And I'm also a systematic reviews editor at Environment International. We're one of the few, if not the only, specialist environmental health journal that has specialist policy on systematic review. And I'm probably the only specialist systematic reviews editor in our field. And I do research into good practice in the conduct of systematic reviews, into evidence mapping methods, and into improving publishing standards for scientific research. I have some interests that I should declare. So I take personal fees from Elsevier for the editing work I do for them, for the journal. And I paid fees from the Cancer Prevention Education Society, the Evidence-Based Toxicology Collaboration, Yordis Group, and I get grants from Lancaster University. These are outside most of the present work, but they do relate to the development and promotion of systematic review methods in environmental health research, delivering training around those methods, and providing editorial services. So, this presentation, I'm going to be explaining what COSTER is and why it's needed, how COSTER was developed, how to use it, how COSTER compares to other systematic review standards. I'll be going through some discussion points in the standard, which people tend to like talking about, I guess, and then respond to some frequently asked questions before talking about next steps. And then we'll open the floor to questions. If you have questions, please feel free to type them into the question and answer box. And we also have a chat window that's open as well if you want to use that. So, COSTER, what is it? It's basically a recipe for conducting systematic reviews in environmental health research, right? So it's 70 expert recommendations, which is intended to help researchers conduct systematic reviews which address an important issue, are transparent about the methods used and the results obtained, and produces valid results. So basically about making sure that a systematic review is a robust, valuable scientific publication. It sets out what research teams should do if they want to do an authentically systematic review. And yes, you can see it at this DOI here. It was written by 21 co-authors over a 4-year period, and we had funding support from the Royal Society of Chemistry, Lancaster Environment Centre, the Economic, Social and Research Council, and the Engineering Physical Sciences Research Council. Okay. So why would you need a standard like COSTER, right, or recommendations like COSTER? All sorts of guidance is currently being used in environmental health systematic reviews. So we have frameworks like Cyrena for endocrine disruptors. We have the navigation guide framework for systematic review. We have TOSCA, the recent draft framework for systematic review there. There's older epidemiological frameworks like MOOSE. There are handbooks like the NTPO handbook. There's the forthcoming IRIS program handbook. There are standards for healthcare systematic reviews, such as those published by the Institute of Medicine and Cochrane. There's other guidance documents by Texas Commission for Environmental Quality, by the European Food Safety Authority, by the Australian National Health and Medical Research Council. And lots of people refer to reporting standards also for conduct of systematic reviews, which might be a mistake, but it's a fact. So standards like PRISMA, right? So there's loads of them. The problem is they're not collectively consistent because one standard will tell you to do one thing and another standard will tell you to do something else. Some are more comprehensive than others. So some provide like top to bottom set of recommendations for conducting systematic reviews, and some maybe miss things out or omit certain steps. Some are more prescriptive than others, right? So some will be telling you that you have to do this and have to do that. Some will give you options of several approaches to doing something. Some make recommendations of dubious validity, right? Particularly maybe the older systematic review frameworks, which were based on practices at the time, which maybe evolved since then. Some are developed for specific regulatory purposes and maybe don't fit a research context. And some aren't actually conduct standards, of course. So you have things like PRISMA, which are a reporting standard and imply a certain set of good practices, but they don't necessarily tell you what those good practices are. And none make explicit specifically for the environmental health research context what are good systematic practices, right? So if you're an environmental health researcher, you're going to be in a bit of a quandary about which guidance you should choose, right? And how do you know if that guidance that you're choosing is consistent with evidence-based practices? This happens at the same time as an explosion in publication of systematic reviews in environmental health, right? So I started working on systematic review back in 2011. I think by 2017, more systematic reviews were published in 1 year than had ever been published in our field before I started working on systematic review methods. And the number of systematic reviews in our field has doubled over just the last 3 years. So it's a good time for providing guidance, I think, on how to conduct high quality systematic reviews given the volume of them being produced. So that's what we set out to do. We wanted to provide the environmental health community with authoritative recommendations for conduct of systematic reviews which are consistent with evidence-based methods. That can act as a benchmark document against which frameworks, handbooks, and other types of guidance can be compared, right? So it answers that question. What do I need to do in order for my review to be systematic? So how did we develop COSTER? Well, the first step obviously was deciding our methodology, and we selected a consensus process, right? Consensus actually has a very specific meaning. The International Standards Organization, ISO, defines consensus as general agreement characterized by the absence of sustained opposition to substantial issues by any important part of the concerned interest, and by a process that involves seeking to take into account the views of all parties concerned and to reconcile any conflicting arguments, right? It's basically the bare minimum that everybody can agree to, right? We assembled a diverse group of environmental health systematic review stakeholders to discuss the prospective recommendations. So we involved methodologists, practitioners, users of systematic review, and impacted groups, right? So that was academia, agency, regulatory agencies, research agencies, industry, and NGOs, basically. We tried to address potential bias or one interest maybe being having greater weight than another by balancing the representation of interests across these stakeholder groups to make sure that when we developed COSTER, we could be confident that it represented a community view. We organised a workshop in 2016 to convene these groups, people. So it was a face-to-face one-day affair at the Royal Society of Chemistry in London. We seeded the consensus process with a discussion draft set of recommendations, right? So basically what I did was I took the Institute of Medicine standards finding what works in healthcare and the Cochrane-Messier standards, so the 2016 version, which was available at the time, extracted all of the recommendations from those documents, compiled them into one single document, and then that's what we used as our start point for discussing what sort of expectations we should have for systematic reviews in environmental health sciences. So we took each draft recommendation, discussed them in parallel breakout groups, we're asking 3 questions basically. Should the recommendation be included in the final set of recommendations for environmental health systematic reviews? How might that recommendation need to be adapted so it's specific for the environmental health context? And then are there any missing elements, right? And if so, how should those be formulated? So is there anything that isn't in the Cochrane Messier standard or Finding What Works that should be introduced if we're going to have a code of practice or set of recommendations or whatever for the environmental health context? This produced kind of a big Excel sheet, and each group completed it with a chair kind of going through making sure everyone's input was taken into account. And then these were consolidated into a first draft of the set of recommendations, which we then discussed in follow-up webinars and email over a subsequent 6 months up to June 2017. After June 2017, we stopped the webinars. We closed out the discussion by email. By January 2018, we'd come to a consensus view. Then by autumn 2019, we managed to draft the manuscript. Drafting the manuscript was hard and took ages. And then the manuscript obviously went through quite a lengthy peer review process, actually in peer review for 9 months, 3 rounds of detailed comment from peer reviewers. This resulted in significant and necessary changes to the framing of recommendations. It didn't change the recommendations themselves, but we did learn a lot about how easy it is to be quite heavy-handed and didactic in the presentation of research recommendations. So we had to do a lot to reassure the peer reviewers that we weren't presenting some sort of like unvarnished truth, but that it was actually a useful contribution to the literature in some way, right? So previous versions of the COSTER manuscript are posted on Zenodo, so you can see how the manuscript evolved from that first submission draft to the final version that's been published. So what do we end up with? Well, we had 31 workshop participants in the first place. 20 participants were able to contribute to the follow-up discussions after the workshop, and we included a postgraduate student because they were being trained in systematic review methods, and it was good experience for them, basically. In the end, 19 participants and the postgraduate signed off on the manuscript. No participants objected to publication of COSTER, and we ended up with 70 recommendations across 8 performance domains. So kind of split out like this. So we have sort of 5 subsections for planning methods and preparing protocol. A lot of the work is in that space because so much of the work in doing systematic review is about planning systematic review effectively through searching for evidence, selecting evidence, extracting data, appraising the validity of the included studies, synthesizing the evidence into a bottom line result, interpreting those results, especially the certainty in the results, and drawing conclusions. So these recommendations are presented in tables, and then those tables are accompanied by a second table which explains and elucidates some of the issues in that in the 70 COSTER recommendations where it's necessary because we're either making a unique contribution to the way in which systematic reviews are recommended to be done, we're providing important clarification for the environmental health context, or addressing an issue of controversy or something like that. So if you're going to use COSTER, of course, well, how do you go about that? It's really kind of a checklist of things you need to do. So it tells you what you need to do a systematic review. Doesn't necessarily tell you how. That requires, expertise and experience and training and understanding of specific context in which you're working, so you can adapt that checklist into a series of into the methods that you need to follow in order to get good results for your particular research question. 70 items probably sounds like a lot. It sort of is, but then systematic reviews are very complex, and COSTER is a comprehensive account of all of the things that would need to be done in order for a review to count as a systematic review. If you go through them sequentially, as part of a structured planning process, it's nowhere near as much as it seems, I would say. It's really not too bad if you take it step by step. Obviously, if you try to take it all at once, it's like trying to eat a big cake, best done by the slice, basically. To help people follow COSTER, very recently, I actually built a working version of COSTER in a platform called protocols.io. So this gives authors a generic COSTER compliant protocol that helps them report each step as they do it. And that helps authors ensure they've met each recommendation in COSTER. And also it helps fully document the plan methods. I'm just going to hopefully zoom to the site very quickly to show you all this right now. Okay, so what happens if you follow this just generic protocol is it breaks COSTER down into a sequence of actionable steps. Each step, this is probably quite small for people to see online, so I'm just going to make it bigger. That's probably working a bit better. It's not working great because it's chopped the table off. Okay, so the first recommendation in COSTER is to assess the team's combined competence and conduct of a systematic review. So what happens here in protocols.io is we've created a step with a table in it, which has each of the core competencies for conduct of systematic review and allows the team to enter the team members' initials next to each of those core competencies so they can be confident that they know what the core competencies are, they know how they fulfilled those core competencies, and then once they filled out that table, they can check off the activity as done and then move on to the next step in the planning process, which deals with recommendation 1.1.2, which asks the authors to identify the information management practices and tools for each stage of systematic review. And then these are the key information management components. And then the systematic review authors can explain how they're planning to, what tools they're planning to use for each of those steps. Once they've completed this table, they can check off the task as done and move on to the next task, which addresses recommendations 1.1.3 and 1.1.4, which is about listing the potential conflicts of interest of the authors. And how to complete each step is described in each of these steps, if you like. And then you just can keep going down each step one at a time, completing each part of the process and be confident that you're meeting each of the recommendations. And then when you complete it, you can print this completed protocol off as a template protocol that then you can use in either following your systematic review plan, you can post it on a preprint archive, or you can write it up as a manuscript and submit it, say, to a journal that publishes protocols. So we hope that's going to be useful, and I'd be very interested in people's experience of using it. And if anybody wants to test it, I'd be very happy to provide a short training on how to use it. So then, of course, there's a matter of demonstrating compliance. And this is kind of a big deal for us as authors because we don't want people faking it that they've followed COSTER. Because claims of following standards such as COSTER are always open to potential abuse, right? They might be deliberate, it might be inadvertent, but it is a mechanism for artificially elevating a reader's perception of the quality of a piece of research, right? You've probably all seen systematic reviews that say, you know, some exposure, some outcome, a PRISMA compliant systematic review or something like that. You don't know if the systematic review is actually compliant with PRISMA, it's just the author's saying it is. And quite often the author is saying it is, and actually the systematic review is not compliant with PRISMA or something. So it's an inaccurate claim. What we say authors should do is they should show compliance via documentation of which steps were and were not followed, and not just state, for example, that COSTER was followed, right? So better language for describing compliance with COSTER is things like COSTER was referred to in planning and conducting the systematic review. We chose not to follow recommendations X, Y, or Z because of, you know, some good reason. Or a completed protocol generated using the protocols.io template is at such and such an online location. And that way the reader can judge whether or not your systematic review has been compliant with COSTER and doesn't have to make any assumptions about how true your own judgment of that is, right? So there's a number of discussion points in COSTER, right? Lots of points of interest. It's a big document, it's probably inevitable, right? There are probably 9 areas overall where COSTER makes recommendations which are uncommon practices in environmental health systematic reviews, or it develops and clarifies general good practice in systematic review. This relates to the use of protocols in planning environmental health systematic reviews. That's quite uncommon at the moment. We've got protocol publication practices, which it kind of develops a bit and provides a bit more clarity on that. There's matters of disclosure and management of interests, which it clarifies. There's the interpretation of the external validity of the evidence. That's very uncommon in systematic reviews, even in healthcare systematic reviews. There's assessing the internal validity of included studies, which it clarifies. There's the formulation of systematic review objectives, which it clarifies. There's quite an extended guidance section on inclusion of grey literature, which develops, I think, some of the existing standards in that regard. There's talk of assessing certainty of the evidence, which is still quite uncommon in environmental health systematic reviews. And there's the matter of making policy recommendations, which it also clarifies. I'm not going to go into all of those now, we'd be here till tomorrow. So I'm just going to pick out 3. So there's protocol publication, disclosure and management interests, and assessment of internal validity of included studies. These were the things that the peer reviewers found most controversial. And we had a lot of very interesting back and forth in the review process on this. So we'll just dip into that very briefly now. So, protocols. It's actually still very uncommon for environmental systematic reviews to have a formally pre-published protocol. We're seeing an increasing number of registrations in places like Prospero, and we're encouraging systematic review teams to submit protocols to us at iJournal, but it's still relatively rare. What COSTER recommends is that protocols be published in a two-stage process, right? We distinguish registration from publication. So registration is something you do in Prospero, where very early on in your systematic review planning process, you'd be showing intent to conduct. And that way you can tell somebody else that you're going to be doing a systematic review on this question. So if they were thinking of doing a similar systematic review, they know that they don't need to worry about it, basically, and they should do something else. Prospero registrations, however, rarely provide enough detail for full transparency in plan methods. And actually, Prospero registration doesn't really have a clear impact on the validity of those proposed methods, right? So we need an additional step to be confident that a registered protocol is actually like a good, robust plan for conducting a systematic review. So we say that people should publish their systematic reviews, by which we mean they should go through an external peer review process before the complete protocol is posted online in either a preprint archive or is formally published in the journal. So this provides checks on the methodological choices being made by those review teams. And we know that peer review of methods in a project, right, before the project is undertaken, results in better project outcomes. We know this from the work being done by the Open Science, Centre for Open Science on registered reports formats for publishing research. Then there's the matter of handling conflicts of interest. So in COSTER, we distinguish between two types of interest. We have potential and apparent conflicts of interest. So potential conflicts of interest is any interest which is relevant to the conduct of the systematic review. It can be literally anything. So it's not just financial, it can be intellectual. You probably do have an intellectual interest, because if you didn't, you wouldn't be able to conduct the systematic review in the first place, right? The point is not to be frightened of potential conflicts of interest, I would say. Then you have apparent conflicts of interest, and those are interests which pose an important risk to the integrity of the systematic review. These are the conflicts of interest that need to be handled and managed effectively if that systematic review is not going to be either not trusted or produce biased results because potentially of the expectations or agenda of the people conducting that review. So what you do is you declare all potential conflicts of interest, right? So anything that is relevant, that is an interest, should be declared. And then what you need to do as a research team is you should evaluate all potential conflicts of interest as to whether there are apparent conflicts of interest. So you go down that list of potentials and you say, okay, this one and this one, these are apparent conflicts of interest because if these are at play in the conduct of the systematic review, then those might undermine the integrity of the systematic review. So we need to make sure that these interests don't influence our processes. So what you do is you exclude apparent conflicts of interest from decision-making roles. They might be useful in, say, advisory roles, but it's important that they don't get to decide how a systematic review is done. And what this does is it makes all relevant interests known, so you can be completely transparent about those, and it makes all decisions about how those potential interests are identified as being apparent interests and then how they've been managed. So what it does is it just provides total transparency about the role that the interests of the authors has had in the systematic review, and it also makes transparent how the potential presence of apparent conflicts of interest have been prevented from influencing the review outcomes. Then we've got the assessment of internal validity of included studies. Right, so COSTER recommends risk of bias assessment, so that bias in included studies is not transmitted through to the findings of systematic review. So that's pretty standard for systematic review practice. What it does not do is specify a qualitative domain-based approach. And the reviewers did ask, and people have asked us questions about this, because it's surprising, because it is the current state of the art in conduct of risk of bias assessment in systematic review. So Cochrane have a domain-based qualitative approach to assessing risk of bias. Nearly all the systematic reviews all the systematic reviews are published in Environment International take the same approach, right? So why have we not specified that approach in the standard? Well, what we didn't want to do was to imply that other approaches of equivalent validity are somehow not systematic. And one of the things one needs to be careful about in defining research standards and making recommendations about how to do research is not to inadvertently apply a break to alternative methods of equal validity being developed. So there are some times when you can apply, say, quantitative risk of bias approaches, or you can use triangulation methods and things, which in a given circumstance might produce results which are as good as a domain-based approach, and there's still risk of bias assessment, so they should be allowed. So we didn't want to inadvertently exclude those approaches as somehow being non-systematic. We did specify, of course, the need for transparency, for grounding in evidence that the bias is important, for conduct against clear criteria specified in the protocol, and for ensuring that study limitations are not mischaracterized, right? So we did all the normal stuff around that. So, frequently asked questions. What have people been asking us about this? There's probably three main questions. I've shown you four main questions. There are four main questions. Why are there any recommendations and which are mandatory? How successful was the consensus process? And how does COSTER relate to existing frameworks and guidance? Those are good questions. So, why any recommendations? It's actually a very difficult question to answer because it gets into the nitty-gritty of making research recommendations and defining standards and things. And it's very hard to explain why we just found it so difficult to say that something must be done rather than something that should be done, right? And there are kind of two main reasons why we couldn't really come to consensus on this. The first was kind of theoretical, right? Because like none are really optional. All of these practices are being recommended because they're important, and some are really important, right? But when you're writing something down on a sheet of paper and you ask someone to follow it, you can't make them do anything on that sheet of paper. So they're all treated as recommendations anyway. So, you know, why try to make something compulsory if you have no hold over the person who is doing the systematic review, right? And there was also the practical matter of it being an extremely lengthy and challenging consensus process already that took us a year to get through, right? And we ended up excluding a third of our group simply because they didn't have the resources to engage in that consensus process. To try to extend the consensus process to accommodate the distinction in mandatory and recommended practices was simply not practical given the resources which everyone had available to them at the time. Yeah, so because we're not the product, COSTER isn't the product of an organization such as Cochrane, we can't really tell anyone to do anything, right? Cochrane can say, if you're going to do a Cochrane compliance systematic review and you be published with us, you must do these 10, 15, 20 things, right? Otherwise, you just have to go somewhere else and be a non-Cochrane compliance systematic review, and that's fine. But COSTER was just the activity of initially 31 experts, eventually 20 authors, making some recommendations to other researchers. And we just didn't feel like we had that hold over people. Also, absolutism about what should and shouldn't be done was kind of a huge turn-off for the peer review process, and we were getting huge pushback on whether they should be published at all because we were making such strong recommendations in the first place. And this is something that's definitely can be addressed in future development. What COSTER does do is allow people to be, or encourage accountability and transparency, I should say. So you know, as someone who has COSTER as a reference point, and you're looking at a systematic review, and these people who did the systematic review said, you know, they were using COSTER in the planning process. If they don't follow a recommendation in COSTER, you can ask why, right? There are good reasons for every recommendation. If someone doesn't follow a recommendation, they should be able to explain why they didn't. And if they didn't, it should be transparent that they didn't. And all these things are possible because of making each of those 70 steps of systematic review fully explicit. And a user of COSTER, such as a research commissioner or editor, can make certain elements mandatory if they want for the context in which they're working, right? So at Environment International, I require risk of bias assessment and systematic reviews, right? And we recommend a domain-based approach to achieving this, though we don't force everyone to use a domain-based approach if they don't feel like it's the best approach given their context and if they can justify that decision. So the consensus process, I thought, you know, it's hard to say for yourself how successful your own processes are. I think we achieved good stakeholder balance. We maintained the contribution of NGOs, for example, through the process, which was quite difficult. Wasn't as easy to operate that consensus process as we hoped. I mean, it turned out that documenting all the discussions and the decisions in the discussions when you're dealing with 70 recommendations being discussed variously by, you know, 10 people at one time and 8 people another, and then 15 people the next week is incredibly difficult to do. So I think in future we would certainly be looking at how we document our process better. We definitely needed more opportunities to meet face-to-face. That would have allowed us to do more in the consensus process, I think. And the length and intensity of the process, as I've alluded to already, did make it challenging for people to participate. So if you can reduce the entry barrier to that consensus process, you might get more input from a greater diversity of people. And of course, you can always have a broader group. So relationship with frameworks. Well, COSTER is a recipe for conduct environmental health systematic review, and it breaks down the systematic review process into a series of actionable objectives. So it's the what rather than the how. What frameworks such as SIRENA for endocrine disruptors, the navigation guide, and the NTPO handbook do is they provide detail on the how. So we can say what you should do, and then the methodologists who develop the navigation guide will tell you how to do it, right? What COSTER does when it's read in conjunction with guidance is it provides a check on the validity and completeness of the recommendations and guidance in a given framework, right? So you can say, is this good advice? And COSTER will help you make a decision as to whether the advice you're being given in a framework is good or not. You can say, has anything been overlooked? Are there any gaps in that framework? So for example, if you're thinking about this in terms of conducting a SIRENA-based systematic review to identify endocrine disruptors, well, SIRENA was developed in 2014 to 2015, and it prevents various options for conducting each step of a systematic review. So I was involved in development of SIRENA, and we felt that we had to give people different ways of doing things, because at the time, there are various systematic review practices that were perhaps not as well established as they needed to be in order for us to be able to point at something and say, you should do that rather than this other thing, right? So what COSTER does now is it helps people choose among those options, right? So it'll help you make better decisions about your methods. For improving the recommendations, COSTER is very much a first step, right? So it's not trying to tell everyone that this is the absolute truth of the matter and this is how systematic reviews should look forever, right? And we're not even expecting everybody to agree with us, right? These standards need to be developed, okay? So we recommend following David Mower's 2014 framework for development of reporting guidelines, right? And this is written up in the manuscript in some detail, which would involve a systematic review of existing standards and guidelines, a systematic review of the prevalence of current research practices, a critical appraisal of existing guidelines and current research practices for completeness, base validity and construct validity, and also a process to determine community consensus on best practice and the criteria for a guideline. It's a big complicated process. It requires a lot of time and effort and money. So really kicking on recommended practices and conduct systematic review requires a lot of careful thought and really a dedicated group to be set up, really. So overall, if followed, I think COSTER should help authors conduct a useful, transparent, and credible systematic review of environmental health research. It's not perfect. COSTER can and will be improved on as we better understand methods for conducting environmental health systematic reviews, as community views on which methods are a bare minimum for robust systematic review also develop, and also as our ability to capture community views in a consensus process advances. I don't think we have, as scientists, necessarily a huge amount of experience in developing and following consensus processes, certainly maybe not environmental health. So the more practice we get at that, and the better we get at understanding how those processes should work in the context of developing research recommendations, I think the better the end product will become. It is, of course, I still think, the most comprehensive, explicit guidance for environmental health systematic reviews, and it exceeds current practice in most systematic review publications. So people who follow it should do better. And that's really all I have to say. So thank you ever so much for listening, and thank you to EBTC for giving me the opportunity to talk about this. If anyone has any questions, I suggest you pop them in the question and answer box and into the chat box if you would like.